are ready. Are we ready? We continue. Thank you very much. This is a press statement on update on the Social Health Authority rollout. The government, my name is Dr. Abdi Mohammed. I'm the chair of the Social Health Authority, and with me are providers, the PS for medical service, and their members, and the management of Social Health Authority. The government of Kenya endeavors to provide the highest attainable standard of care to all Kenyans without incurring catastrophic expenditure. As such, we are on day 6 of the rollout to social health insurance. First and foremost, I would like to thank all Kenyans who have engaged and supported in the process of transition. We also wish to thank the many Kenyans who have given invaluable feedback on the challenges they have experienced during this transition. We assure you that we are working round the clock to ensure all challenges have been and continue to be addressed. We wish to update as follows. Number 1, registration. We have, as of today, 6th October 2024, registered a total of 12,704,548 members into the Social Health Authority. This number includes verified members who were under the defunct NHIF and who have been transitioned to the Social Health Authority as per Legal Notice number 147 of 2024. Registration does not have a stop end. It's a continuous process and is ongoing through the USSD *147# or web-based portals on www.sha.go.ke or www.afyayangu.go.ke. We have also noted that most beneficiaries are registering but not adding their dependents. We call upon all to add their dependents for them to access health care services as well. Therefore, all registered SHA beneficiaries are entitled to free access to primary health care services under the Primary Health Care Fund at Level 2 dispensaries, 3 health centers, and select Level 4 health facilities, and emergency services in all health facilities. Number 2, contracting of health facilities. All public hospitals, Level 2 to 6, have been contracted and are offering services to SHA-registered beneficiaries. With regard to private and faith-based health facilities, as of today, 6th October 2024, a total of 1,442 health facilities have since returned duly signed contracts and are therefore offering services to SHA-registered beneficiaries. Yesterday, we had reported a total of 1,577 health facilities contracted. However, this was an error due to duplication of name of facilities. The list of all health facilities contracted and offering services is available on the web-based portal on sha.go.ke/resources categories/2 and has been segregated as follows for ease of identification and access. A, contracted government facilities. B, contracted private and faith-based facilities. C, contracted facilities offering cancer care. And D, contracted facilities offering renal care. Further, following our engagement with private and faith-based hospital associations today, 6th October 2024, we have agreed that all their health facilities shall return duly signed contracts latest Tuesday, 8th October 2024. However, they have committed to ensuring continued access to health care service to all SHA-registered beneficiaries during this transition period. Number 3, The SHA e-claim system. It's important to know that during the initial days of the rollout, we experienced challenges on the e-claim portal, particularly on member verification and claim processing. We have since addressed the system challenges, and we wish to update as follows. A, the e-claim system is up and running. B, a total of 10,904 end users have been trained and enrolled and their credentials sent. C, services are currently available on the SHA e-claim portal. D, for healthcare providers who have not received credentials, SHA has circulated a provider portal user onboarding form. Healthcare providers are hereby encouraged to fill and submit the onboarding form immediately. We have also made sure that the health insurance claim system, HICS, operating under the defunct NHIF, continues to be in operation for member verification, discharge of patients admitted before 1st October 2024, and for claims management of active enhanced schemes whose contracts have not yet expired. Number 4, on the issue of pending bills and bills arising during the transition, we have agreed the healthcare providers that a joint committee chaired by the Principal Secretary, State Department for Medical Service, shall be constituted to undertake verification of all pending bills incurred under the defunct NHIF. Further, we have committed to the healthcare providers to prioritize the bills during the transition period, which is from 1st October 2024. As a result, there shall be frequent consultation with all healthcare providers. Finally, we wish to reaffirm our commitment for a smooth and seamless transition to ensure in particular that no registered SHA beneficiary is denied healthcare services. We are available for support and assistance through the Social Health Authority Customer Experience Center at 0800 720 601. Thank you very much. And for now, I will allow the chair of the associations, each one of them to give some remarks. I will start with Brian Lenga, who is from RUFA.
Thank you. My name is Dr. Brian Lenga, chairperson of the Rural and Urban Private Hospital Association of Kenya. We have had a very extensive engagement with the Social Health Authority led by the chairman and the principal secretary for State Department for Medical Services. I think first is to speak to healthcare providers across Kenya, in rural Kenya especially, and tell them that we have received reassurances from the Social Health Authority that, number one, the HICS portal, the NHIF portal that you have been using to verify clients remains open, and you can continue to use it to verify clients before you offer service. We have also received reassurances that in terms of your claims, that number one, the SHA portal for claiming should be up and running within the next 24 hours. So you should be able to claim through the SHA portal within the next 24 hours. But even if that is not the case, especially for the claims that you have been incurring since the transition began, we have received assurances that those claims, the settlement of those claims will be prioritized and that those claims will be honored. So I know there has been significant worry what is going to happen to those claims that you have been preparing in this time because the portal was not available. But we have assurances that one, the authority will honor those claims. Two, those claims will be prioritized. In the next 24 hours, the portal is going to be open for you to continue claiming. There are also quite a number of providers who are not able to offer services, have not been able to offer services because they did not have credentials. As the chairman of the Social Authority has just indicated, there is a form which has been circulated. It is a digital form. I want to call all healthcare providers in Kenya. Please get access to that form, fill that form immediately, and we have received assurance that within the next 24 hours, you will have received credentials to start serving Kenyans within the SHA portal. The other matter we have received assurance is for hospitals that offer outpatient services by capitation, especially our level 2 and level 3 hospitals. Those are the dispensaries and health centers. We have been assured that continuity of service under the capitation model for the next 90 days is guaranteed, and also for some select level 4 hospitals that shall be happening. So in case a Kenyan comes to your hospital, please verify that they are under capitation and do not turn them away. If you verify, proceed to offer them care. The details of how that reimbursement is being conducted are the subject of a committee that has been established, and that committee shall be giving a way forward in the very near future. Finally, I want to talk to providers about the critical issue of pending bills. On the issue of pending bills, as you have heard, we have been assured, and a committee chaired by the Principal Secretary has been formed to look into the pending bills. But as a provider representative, I want to say very clearly that the issue of payment or settlement of bills is not only a sign of goodwill, but is essential for us to be able to provide services. So I am calling upon the state agencies which owe money to the defunct NHIF, without any further delay, release those funds. We as providers are ready to cooperate, but we will cooperate when we have the money as well, because it is necessary for the provision of services. Other than that, we are significantly happy with the meeting today, and we want to thank the Social Health Authority for taking the opportunity to call this engagement. Thank you.
Next will be Dr. Eric Musau.
Thank you, members of the Fourth Estate. My name is Dr. Musau. I'm the current chair of Kenya Association of Private Hospitals. And first, I would like to reiterate our position is that we are committed to service delivery and continued access of care to patients as enshrined in the Constitution. And we do understand that in the last 6 days or so, we have encountered quite a myriad of issues. One has been member identification with the new portals, pre-authorizations for services that require pre-authorizations, and lodging of claims for services rendered within the gazetted tariffs. So as per today's meeting, the Chair Social Health Authority together with the PS have reassured Kenyans that we should be able to have these portals up and running by close of business today. As well, when it comes to service provision, especially for providers who were not yet empaneled by NHIF, that has been clarified, that they can now proceed, provide service as long as they are gazetted by Kenya Medical Practitioners and Dentist Council. So the rest has already been mentioned by my predecessor, and we want to thank the SHA team, the Ministry of Health, for the continued support. Thank you.
Thank you very much. I think next, Dr. James Mina, Vice Chair Chuck.
So thank you, James Mina, Vice Chairman Chuck. Much has been said by my colleagues, but then we must appreciate that the mission hospitals have been key, especially in Chuck, to provide services to Kenyans even during this transition. So we want to assure that Chuck supports this transition that the government is undertaking from NHIF to SHA. And let us be positive, because upon success, it's going to be a game changer in this country. And I must appreciate the fact that we are working to reconcile our claims, especially. We have so claims that have been pending from 2015 to date. And so the commitment from PS Mr. Hari is key. And of course, we're going to make sure that the pending bills, of course, some of us, we have issues with salaries for our workers, supplies, and so we appreciate that commitment that we're going to have the government paying our bills even as we move to SHA, so that we can be able even to offer similar services to our people as we move forward. So thank you very much. May God bless you.
Thank you. Next is Ms. Jacinta Mutegi, Head of Health, KCCB.
Thank you. My name is Jacinta Mutegi. I head the Health Department at the Kenya Conference of Catholic Bishops. I also represent providers on the board of SHA. And I'm very humbled at the very good meeting we've had with the representatives of the associations of the private and faith-based health service providers. I think a priority for us in the church was the suffering we've seen in the last few days. And from today's meeting, I think there's a commitment for us to continue offering healthcare services, both from on the side of state and non-state. And the other challenge that was hard pressing was the issue of payments that the chairman and the PS have alluded to in the statement. We anticipate some payments to be made to the providers so that we can pay salaries and pay for commodities that has been a big challenge in our facilities. Largely, just to say is that the church supports UHC rollout and supports this initiative, and we have been providing healthcare services to Kenyans even during this transition. And like with all transitions, we anticipated that this was not going to be easy. And we are happy that consultations with providers, with the government, are leading to ways that to work around, working around the handles that we're experiencing during this transition. Thank you, and God bless you.
Thank you. Then the chair for Kenya Healthcare Federation, Dr. Gombe.
Good afternoon, members of the Fourth Estate. As I've been introduced, my name is Dr. Kyenge Gombe. I'm the chairman of the Kenya Healthcare Federation. And the Kenya Healthcare Federation brings this whole ecosystem together, which is providers, payers, suppliers, suppliers of technology, suppliers of commodities, the entire ecosystem which is necessary to deliver care to those who need it. And we work within a framework where you have patients, you have providers, and you have payers. And the most important person in that trinity is the patient, because ultimately a healthcare system is designed to deliver value for money, quality healthcare to those who need it. And that's why we are here on a Sunday, to address the challenges that Kenyans have faced in the last few days since the transition began. And transitions, as you all know, generally tend to be challenging. And this is a very challenging one because you are trying to get 54 million Kenyans to all belong to a system where we pool resources, and then when we need care, we do not have to pay at the point of care. And therefore, it becomes extremely unfortunate if one can't get care when they require it. There have been questions about, are we better off, and why did we bother to change, right? I cannot pretend to speak for the government of Kenya. In fact, my entire practice in the health sector, for those who may know my history, has been one of campaigning for a better healthcare ecosystem, going back all the way to the year 2000, going back to the change that we are trying to move from NHIF to NHIF. And there are certain very good changes that are taking place. And for me, the most significant is that the team that runs SHA, led by Dr. Abdi here, can only spend 5% of the money we pay on themselves. The other 95% is meant to give us services, and that's a law. And that's what we want to hold them accountable for. Why? Because back then, the period I referred to in 2005, NHIF used to spend 80% of the money on itself, 10% on fraud, and 10% on us. This is public information, it's available. So at that time, we had declared NHIF a parasite on Kenyan society. Because if you are given a shilling and you give the owner of the shilling 1 cent, 10 cents, clearly you are not adding value, you are just taking resources. So that, for me, is one of the most significant changes. But there are a few others, and some affect providers. In the past, the tariffs offered, you've had hospitals complain the money is not enough to pay for care. We now have a tariff board that will be looking at how much it takes to provide service so that Kenyans are better advised on what it actually takes to economically render a service in a particular area. So that if it's a hip replacement, we know what it costs, what SHA will pay, and therefore whether we need to pay anything over and above that or not. And then the governance structure includes an appeal tribunal for individuals and for providers. In the past, everything has happened here. NHIF has been judge, jury, and executioner. If you are not happy, the alternative were the courts, and not many of us took that option. So there is a more open governance structure, which I urge every Kenyan to take advantage of to hold SHA accountable for the promise that we've been given. And the promise is that Kenyans should not have to do catastrophic spending when they fall sick. So my appeal to our people is this. The government has given us a scorecard, all of us, to score them on how well they are doing on health service delivery. Let us use that scorecard to give an E where an E is well deserved, and to give an A when they deserve an A. And I would appeal especially to those who have influence, the media included, to be at the forefront of using a scorecard to give feedback to the management, to the government, whether we are getting quality care or not. The Kenya Healthcare Federation intends to be at the forefront of doing that scoring so that SHA and Kenyans are aware of how well we are doing in giving service. And it's not a difficult score to give, because the first is whether people have access, which is what we are addressing today. And the second is whether the quality of care is above a certain standard, which is intended to be achieved by giving Kenyans the option of taking your SHA benefits to the provider who you think is best equipped to give you value for money. In short, we will have to compete on the basis of quality in order for you or any other Kenyan to choose us as your preferred service provider. And as you know from my education system, because there is an annual scorecard for schools on academics, on sports, on co-curricular activities, principals, despite the fact that they run public schools, are very, very sensitive to how well they score at the end of the year. So let us work together to make sure that hospital administrators, and I'm one, feel the same pressure that principals of schools feel every year, trying to justify their continued stay in office on the basis of their performance. Thank you, and God bless you.
Thank you very much. Finally, I will give a chance to the PS, Harry Kimtai from Ministry of Health, Medical Service.
Thank you, Chairman, Social Health Authority. I want to take this opportunity, ladies and gentlemen, to first thank the healthcare service providers for turning up for this meeting, which was a meeting that we had planned to review on the progress of the rollout of universal healthcare coverage in the country under the Social Health Authority. Indeed, it has been a challenging week. We've received comments from yourself, members of the Fourth Estate. You have highlighted cases where patients have suffered and where systems have not been put in place in the proper way. And we took note of that, and we want to appreciate also Kenyans for giving us time to continue with these reforms and these rollout plans that we have. Today we met just to take stock and prepare for service delivery as Kenyans start the next week. We've looked at our systems, we have reviewed them, and we have now reconciled together with the service providers, because they are the most important stakeholders in this process. We cleared with the county governments, where all the county facilities have been onboarded, and they have been supported with the equipment to ensure that they also digitize their systems, because our delivery of UHC is premised on digitization. The private sector had done quite a lot in terms of digitization, and we are very happy with that. We are only integrating into the system. We had challenges because the systems could not speak to each other, and today our technical teams have worked with them. We are also going to support them in terms of our ICT, and we are combining the ICT from the private sector and the ICT from the county government and the national government to support the system. We have agreed on those areas that the chair of the social authority has read out, but key among them is how are we going as a government to continue supporting them and meeting our obligations, payments of the outstanding bills. We realize that has been one of the biggest challenges because the service providers, their resources are now dwindling and they are not able to cope with additional members of the public who want to seek service within their facilities. We are going to fast track as a government payments of the pending bills. And to help us do that, we have formed a committee under my leadership which will then quickly move and clear any pending bills so that we are able to support them. This is going to be sustainable for them in their service delivery. I want to thank them for committing to the government agenda of delivering universal health care coverage. We also give assurance from the government that we shall commit to meet our obligation for the purpose of Kenyans getting health care. I want to thank you, members of the fourth estate. Let's continue engaging, communicate to us where there are challenges. We shall all close the gaps and make sure that Kenyans get service. I do understand and appreciate that there was slight challenge of communication, especially between us and the service providers, and we have opened the channels of communication. We have now a toll station, our toll-free number that they can reach us. We have opened our call center. We have equipped, we have had additional staff to cope with all that, and I believe next week we should not have any other challenge where we can solve the problem without making the patients suffer. Thank you, and God bless you.
Thank you very much. I think we'll take 3 questions, and we'll give you. Yes, Leon.
You will answer that one. The NHIF cards they went with no longer function. And all healthcare providers from that part of the world tell them that they cannot trust a government that holds healthcare providers over 29 billion shillings. Now you said you're forming a committee. Are you also looking at the Kenyan students outside seek for treatment? And number 2, what are the timelines? Because healthcare providers also need those funds to buy equipment, buy medicines, and sort of the hospitals that they can run.
Thank you. Yes, Emil. The last question? Anyone? If there is none, I will give the CEO the chance to answer those 2 questions.
Thank you very much. Thank you, Leon. Leon, the first question, patient abroad was admitted under NHIF. What do we do about them? All patients where NHIF had given undertaking before the 1st of October will have their bills paid by NHIF. All patients whose admission or whose procedures commenced after 30th of September will have their bills settled under the new fund SHA. There is no lacuna. There is no space in between. Now, a patient found themselves having spent more than what is approved under the SHA benefits,
those instances happen once in a while, where you will find that certain procedures have limits that are below what a hospital is charging. Well, hospitals are at liberty in a number of occasions to charge for conveniences and comforts over and above the basic treatment. SHA is assuring Kenyans that we shall pay for the basic treatment across the board. And we are paying a tariff per condition across the board for everyone. So what is happening here is that it depends on the facility where this patient went to seek service. There are facilities where the SHA rebate will be enough, and there are others where, maybe because of a comfort or another, the SHA rebate may not be enough, and there may be need for top-up. Thank you, Shebet. Chairman.
Thank you. Just some clarifications. There have been a few issues in the media on certain patients who have been denied services, and Mr. Alio will explain what has happened to those patients.
Thank you very much, Chairman. My names are Ibrahim Alio. I'm the Director of Corporate Services at SHA. We have seen some patients who have been actually crying out and suffering. An example was Amze, who actually cried on the TV, and immediately we got that. Actually, we followed up with the patient. The patient, by the name James Ngaruya Kanyore, was a patient from Nakuru who went to a hospital called Sublime Hospital in Nakuru town, in Kenyatta Avenue, and he could not access service the first day he went there. We followed up with the patient. We actually talked to the patient ourselves, talked to the son, who was the caretaker, and actually followed up and made sure that in the next session, he will not going to go through any problem. The next session will going to be tomorrow on Monday, and we have also agreed that we are refunding the 9,500 that was paid by him to the facility. We also got another patient from Mombasa Coast General Hospital, who raised some issue, and we also followed up with the patient and made sure that the next session that he has, which is chemo, which is also tomorrow, will be taken care of. All our branches and the regional managers and all our staffs, the SHA staff across, have been deployed to all the facilities to make sure that patients get seamless services across all the health facilities. And with this, I think, with this agreement and with also all the health provider associations, we shall not going to have any issue. That is our anticipation and prayer. But again, we want to give assurance that should there be anybody who has an issue in terms of accessing health services and is a member of SHA or even defunct NHIF, please reach out to us. We have a toll-free number which we have shared and will continue sharing. Otherwise, we want to assure the nation that each and everyone who actually needs services under SHA will be going to be taken care of. We really apologize for any inconvenience, and as has been alluded here, there are going to always be some challenges when it comes to the issues of transition. Thank you very much.
Thank you very much. I think we have come to the end. Because they have been for the first time, we have a tariff and a benefit that has been gazetted clearly. Because prior to it, we never knew what you are entitled, how much was it, who is paying, how much is being paid to the hospital. So the ones that have been said subject to availability, I would like this now to take back to you as the fourth state and to Kenyans to urge their members of parliament in the next budget cycle
to allocate money to SHA for those two funds, primary health care and emergency chronic critical illness fund, because those are treasury funded funds and they are meant to benefit every Kenyan, irrespective of for emergency whether you have paid or not paid. And for primary, all you need is to register for you to benefit. Thank you very much. Yes, all patients who have paid out of pocket reach out to us and we will do the same for them. All the patients who have paid out of pocket. Thank you very much.
Thank you.
Yes, yes.